Assalamualaikum. I am going to explain the topic of spinal cord. Spinal cord is a long cylindrical lower part of the central nervous system, and it connects the brain and peripheral nervous system, and it contains 31 pair of spinal nerves. And in children, it ends at the level of L3, and in adults, it's ends at the level of L2. And the ending point of the spinal cord is called as conus medullaris. And when we talk about the length of the spinal cord, in male it is 45 centimeter, that is 18 inches, and in female it is 42 centimeter. And there is a covering of 5 meter from L2 to coccygeal 1, that is called as filum terminalis. And the fibers are coming out from the filum terminalis from L2 to coccygeal 1, that are called as coda equina. And when we talk about the layers of spinal cord, then it is covered with 3 meninges, basically the dura mater, retinoid matter, and the pia mater. And when we do a lumbar puncture for the sake of giving anesthesia to patient, or for the sake of getting a CSF culture, then following are the layers that we came across. First of all, the skin, then fascia or fat, and then supraspinatus ligament, infraspinatus ligament, ligamentum flavum, and then epidural space, that is the space between the endosteum and the dura mater. And epidural space, here we give here up to this level we inject to give anesthesia to a patient. And then we have dura mater, retinoid mater, the subarachnoid space, and this is the space where we inject to get the CSF culture because it contains CSF. And then we have pia mater. Next, we have this is the structure of spinal cord, and when we talk about the grey matter and white matter in the spinal cord, then the outer part is covered by with the white matter that contains axons, and it is made up of the dorsal white column, lateral white column, and the anterior white column or ventral white column. And then the grey matter, which is it is in the center in the form of H-shaped or butterfly matter that contains the cell bodies, and it consists of the dorsal horn, lateral horn, and anterior horn. The dorsal horn is sensory, and the anterior horn is gives the motor output, and the lateral horn is only present in some areas from T1 to L2 and S2 to S4. And the dorsal horn, and then we have central canal in the center that contains the CSF. And when we talk about the nucleus of the spinal cord, then the neurons of the spinal cord are arranged in the form of lamina, which are called as lamina of Rex. And from lamina 1 to lamina 4, we have 3 nucleus. For lamina 1, it is post-smaller nucleus. For from lamina 1 to lamina 4, we have 3 nucleus. For lamina 1, it is post-smaller nucleus. For lamina 2, it is substantial gelatinosum, which is for the nucleus of pain. And for 3 and 4, we have nucleus proprius. And 5 and 6 correspond to the base of dorsal column. And then we have nucleus 7, which is contains the nucleus dorsalis, and intermediate medial and medial lateral nucleus as well. Nucleus dorsalis is at the level of RCA to L3, and it has the properties of interneuronal neurons. And then we have ventral horn that contains the medial group and the lateral group. The lamina 8 over here and lamina 9 over here, that contains lamina 9 contains the lateral group of the ventral horn, and lamina 8 contains the medial group of the ventral horn. And then we have lamina 10 that has the properties of interneurons. It contains some neurons and neuroglia, etc. That's it.
Bismillahirrahmanirrahim. Today we discuss about spinal cord and its descendant tract. Descendant tract have two neurons, upper motor neuron and lower motor neurons. Upper motor neuron, first of all we discuss. Upper motor neuron takes input from cerebral cortex. The tract is called corticospinal tract. It takes 60% input from area 4, 6 and 8, and 3, 1, 2 and 5, 7 area gives 40% input to cerebral cortex, which is taken by upper motor neuron. And then this is go posterior limb of internal capsule, and then this go to the pyramid part of the medulla oblongata, and at the lower bones it cross to each other. 10 to 20% it goes ipsilaterally, which is called anterior, and then 80 to 90% it contralaterally goes, which is called lateral corticospinal tract. Then we discuss about lower motor neuron. Lower motor neuron takes input from ventral arm and the cranial nerve nucleus, and then this go to upward. So then It is responsible for our reflex, for example ankle reflex, knee reflex, jaw jerk reflex, and other reflex. If we discuss ankle reflex is if we strike on gastrocnemius muscle, and then nerve is radial nerve is femoral nerve is responsible for that, and segment is uh, S1. So that's is our descending tract of upper motor neuron and lower motor neuron. Then we discussed it takes input from ventral horn plus cranial nerve nuclei. Then we discuss about their lions. So first of all, they discuss about lions, upper motor neuron lions. So upper motor neuron is when upper motor neuron is damaged from above the midbrain, then its decorticate rigidity is occurred. If above the midbrain is called decorticate rigidity. And if the upper motor neuron is damaged below the midbrain, then below the midbrain, so decerebrate rigidity is occur. And if so it is upper motor neuron, and if we damage about lower motor neuron, so if the lower motor neuron damage, so our all of reflex is damaged, ankle reflex, knee reflex, elbow reflex, all of reflex is damaged. So hyperplasia occur and muscle tone is increased. Muscle tone is abolished, and upper motor neuron muscle tone is increased, and muscle atrophy हो जाएगी इसमें अपर अगर लोअर मोटर न्यूरॉन की पैरालिसिस हो जाए, और इसमें मसल एट्रोफी नहीं होगी. एंड देन एंड उसके बाद आएगा इसमें बबिन्स की साइंस नेगेटिव होगा, और इसमें बबिन्स की साइंस पॉजिटिव होगा. और इसके अगर दूसरा अगर हम डिवीजन करें तो पैरामिडल और एक्स्ट्रा पैरामिडल में हो जाएगा. पैरामिडल में तो कार्टिकोस्पिनल आ जाएगा, एक्स्ट्रा पैरामिडल में रोब्रोस्पिनल आएगा, ओलिगोस्पिनल एंड टेक्टोस्पिनल आएगा. रोब्रोस्पिनल जो टेक्स करता है वो इनपुट करता है रेड न्यूक्लियस से करता है और देता है इंटीरियर ग्रे हॉर्न को. एंड देन ओलिगोस्पिनल टेक्स करता है इंफीरियर ओलिवरी न्यूक्लियस से, एंड देन ये भी वही उस इंटीरियर ग्रे हॉर्न को देता है. सो दैट्स आर आवर spinal cord, descending tract, upper motor, lower motor neurons, extrapyramidal or pyramidal, and its lesions. So that's
tract of spinal cord, which carry the impulse of various sensations to the brain. It has three parts. First of all, dorsal column, medial limnicus. It has present two nucleus, calycellus and cuneatus nucleus. All the sensation take to the lower limb and lower trunk. What is the lower limb sensation? Fine touch and pressure, vibration and precipitation. It come out and it meet dorsal root ganglion, and it will go to the dorsal column and come out and go to the calycellus nucleus, and it cross to the medial limnicus, and it go to the Broadman area, 3, 1 and 2, and to the upper limb sensation of the pain compression, and go to the cuneatus nucleus, and it cross the medial limnicus, and it go to the Broadman. Introlateral spinothalamic tract. First of all, it has two tracts. First of all, lateral spinothalamic tract. It has two sensation, pain and temperature. It go out and it made dorsal root ganglion, and it cross the posterior hall, and it throw out the lateral column, and it goes to the and it cross the spinal limnicus, and it go to the Broadman area, Second is the anterior supinal filament tract. It had two sensation, cute, cute, cute touch and pressure. It could go out and make the dorsal ganglion and cross the posterior horn and it throw out the anterior column and it throw across the spinal limnicus and it could go to the Broadman area failure track. It has a three track cuneo cuneo cerebellar. It come out cerebellar. It muscles sensation come out and it make track. It has a three track cuneo cuneo cerebellar. It come out cerebellar. It muscles sensation come out and it make dorsal root ganglion and cross the posterior and it come to the laterals come to through the laterals and tunicate cerebellar nucleus and it go to the superior cerebellar pudendal and it receive the cerebellum as it has second is a interior cerebellum. It go to the and it made also root ganglion and it go to the posterior halls and its sensation go to the inferior cerebellar pudendal and to dorsal cerebellum and its sensation it muscle sensation go out and emits dorsal root ganglion and go to the posterior horns and come to grow and go to the inferior cerebellum pudendal and to the cerebellum. Uh, Superior cerebellum it cross it it only.
Huntington disease is a progressive brain disorder and caused by a single defective gene on the number chromosome number 4, one of the 23 chromosomes that contains the entire genetic code of the humans. In Huntington's chorea, we have personality changes, dementia. Age related to the Huntington's chorea is between the 20 to 40 years. We have uncontrolled, brisky, jerky, random, rapid, purposeless movements of the body in Huntington's chorea. Next, we have sand white dance. It is related to female especially between the ages of 5 to 15 years of age. Sand-wire disease is a neuropsychiatric manifestation of rheumatic fever. It may come alone or come other with manifestations of rheumatic fevers. Next we have the Wilson disease. Wilson disease is a rare genetic disorder characterized by excess deposition of copper into the various body tissues, particularly into the liver, brain, and the corneas of eye. The disease is progressive and it is left untreated. It may cause the hepatic diseases, central nervous system dysfunctions, or even death. Initially, there are involuntary movements of the face, mouth, and hand.
Assalamu alaikum guys, how are you? Today our topic is poliomyelitis. Polio is a disease caused by polio virus. It mostly happens in children younger than 5 years old. Most countries in the world like USA, European Union, China and other countries are also polio free except Pakistan and Afghanistan. There are many symptoms of polio viruses. About 90% of people infected by polio viruses have no signs of the disease are just mild symptoms. Early symptoms of poliovirus are like those of influenza virus, like fatigue, fever, headache, neck stiffness, pain in arms and legs, vomiting. While mostly people recover from this virus, this disease can cause very serious problems like numbness, a feeling of pins and needles in the legs and arms, paralysis in legs, arm or toes, trouble in breathing because of muscle paralysis in lungs, death when the muscle you are using for breath become paralyzed. There are many ways of diagnose. If you have any symptom, contact with your doctor. The confirmed polio healthcare provider will take a small sample of cerebrospinal fluid, saliva from your throat, and stool. Thank you.
I will tell you about a neural disease known as amyotrophic lateral sclerosis. In this disease, both upper motor neurons and lower motor neurons get damaged. In upper limb, there is a spastic paralysis, while in lower limb, there is a spastic paralysis. For the awareness of this disease, there is a widely known challenge known as ice bucket challenge is used.
Assalamu alaikum. My name is Abdul Samad. I am a student of OSH IMU. Today my topic is TAPS dorsalia. TAPS dorsalia is a slowest degenerations of the nervous cell and nervous fiber that carry sensory information of the brain. The degenerations nervous is the dorsal column of the spinal cord. The portions closest to the back of the body and carry information that help maintain person's sense of positions.
Today my topic is anterior spinal artery. The anterior spinal artery supplies the anterior two-thirds of the spinal cord and runs along the entire length of the interior surface of the spinal cord. If the blood flow through the anterior spinal artery becomes occluded, the anterior two-thirds of the spinal cord will suffer an infarct resulting in bleed. There are three longitudinal arteries: the anterior spinal artery and the two posterior spinal arteries. The anterior spinal arteries form rosterally from the union of the two anterior spinal branches of each vertebral artery in the level of foramen magnum. The posterior spinal arteries are a pair of arteries that supply the respective ipsilateral gray and white posterior columns of the spinal cord.
Is the disease or lesion of spinal cord central canal and that separates the interlateral tracts of spinal cord. That's why the person loses his sense of pain, temperature, and touch from both sides of the body, and at across in lower cervical and abrothoracic. That's why the sensations are lost in the areas.